Welcome back to the program. You're watching Daybreak live on Trust TV. Here's another reminder: you can watch the show on the go by joining our Facebook and YouTube live streams. You can also do so by visiting our website trusttv.com, so you don't miss out on the conversation. Speaking about the conversation, let's introduce you to today's talking point for Daybreak Interactive, so you can join in on what this means, especially because health is wealth. Actually, health is more than wealth, but that is the saying. And we're talking about NHIS coverage, and whether you have enrolled, and whether you are covered, and whether you're getting quality service for that. Because as we do know, healthcare services in terms of costs have gone up astronomically, much like everything else in this country, because of inflation, because of how bad things are. Cost of medication has gone up significantly from the beginning of the year or late last year. 150% for cost of medication, antibiotics and the likes, and a lot of people have not been able to make ends meet in that regard. And this is one of the reasons why the NHIS was thought of as a government policy or program in the first place, to mitigate those gaps that exist, because people cannot afford to pay for some of these bills on a day-to-day basis if they don't have some sort of insurance coverage that can take care of the burden of the cost of medication or Medicare. So let's talk about it. Are you covered? What are some of your challenges, especially with regards to access, with regards to quality healthcare? I know the Minister of Health recently did talk about these basic primary healthcare centers offering services, and how people need to do a lot more by giving the government feedback about some of the gaps that they are experiencing in terms of accessing quality healthcare. So we're talking about this from this broader perspective also, because millions of Nigerians are not covered. In fact, there is a big communication gap about who can get coverage, who can get enrolled, what amount of money people need to pay. I mean, it's not a staggering amount, but also if people are enrolled, what kind of services are they getting in return as value for their money? So the phone lines are open. You can also reach out to us via WhatsApp if you have a thing or two to say about the enrollment process. If you have a thing or two to say about the service delivery, feel free to do so, because health is very, very important, and it, I suppose, signposts why the Tinubu administration allocated about 7% or so of the budget to address the healthcare sector. So let's talk about it. NHIS enrollment, are you covered? And if you are, what kind of services are you getting? Are you satisfied with those services? If not, what can be done to help facilitate it so that it can improve your general well-being? And of course, some studies have shown that coverage is gradually moving in a positive direction, but a lot more people are not covered by the NHIS. So what are some of those issues? Talk to us. Let's hear what you have to say about this one. The number is showing on your TV screen. And of course, rules of engagement. Please ensure that the volume is turned down to the barest minimum, so that we can have a smooth sailing conversation. Try as much as you can to be concise with your takes, so that we can take as many opinions or viewpoints on this one. And I just want to give you a little insight for those who would say we don't know how it works and things like that. By design, it costs at least 15,000 or exactly 15,000 to register for the voluntary contributor social health insurance program, which is the VCSHIP, I beg your pardon, and 10,000 naira per head. And it also costs 12,000 naira to register for the National Mobile Health Insurance program, and it's also at the cost of 9,000 naira per head. I believe we have our first caller for the day, so let's speak to our first caller. Hello, good morning. Hello, good morning. Hello, good morning. All right, give it another try. The network has been less than usable for the past couple of days. I don't know what your experiences are. Perhaps maybe we need to talk about this one in another segment. But of course, give it another try. Sometimes it can be disappointing on first try, but try again. The number is still showing on your TV screen. I don't know how many options you have there on your TV screen, one or two, but Try one network. If the other fails, try the other one. See if you can get through. We'd love to hear your take on this one. This is a fast developing issue and, of course, a very much important one, because the health of millions of Nigerians has been at risk for the most part of the last 1 year or so, because of the astronomical cost of Medicare. And that is where insurance is supposed to kick in, so that people don't have to pay out of pocket for these services, especially when you're dealing with malaria, for instance, and all the other underlying endemic health challenges that we are right now dealing with. So those services could be life-saving services that people need at the rural level, at the community level, and so on and so forth, at the primary healthcare level, and so on and so forth. So what kind of coverage do you have when it comes to the NHIS? If you're surprised that there is even an NHIS, let's talk about it also, and what you think about the initiative and what it can do to help mitigate those healthcare needs and challenges that people have across the country. The numbers are showing on your TV screen. As I did say, you have the option of sending us an SMS through our WhatsApp platform. That way we can also read some of your thoughts and contributions. Another caller has just joined the conversation. Hello, good morning. Hello, good morning. Hello, good morning. It appears we are struggling with the connection this morning, so feel free to try again. This is an all-important talking point that needs to, be addressed, because most Nigerians are either unaware or are not satisfied with the performance of the healthcare insurance. And I know that HMOs have come under a lot of scrutiny over the past few years about how they are also not helping in terms of the implementation of the insurance scheme in the country. Hello, good morning. Hello, good morning.
Good morning, how is work?
Fine, thank you. Who is on the line and where are you calling from?
I am Rabiu Salisu by name from Katsina State.
Rabiu Salisu. How is Katsina this morning? Which part of Katsina?
Katsina State, the weather is somehow cold and windy.
Yes, this time of the season is a very tough one with the Hamatan season setting in. Go ahead, Malam Rabiu. What is your take?
So, the primary healthcare system in Nigeria almost is in comatose.
Why do you say that?
It is not functioning very well. When you look at the rural area where most of the people need to be given this support, so there is no staff. Most of the buildings were dilapidated. No technical staff that can take care of the minor illness before it reach the comprehensive health center or tertiary health center like Federal Medical Center or general hospitals. So if you go to rural area, the little cases where sometimes people, especially pregnant women, are dying because of lack of drugs. Yeah. Lack of simple drugs, and when you go to this hospital, there is no staff. Sometimes lizards, snakes are sleeping there. So there is need for the government to wake up to rescue the situation in order to reduce the mortality rate among the not only rural areas.
Right, I get your point, and I think, I beg your pardon, I think it's a very important point that you're raising, generally speaking. But in terms of specifically talking about healthcare insurance, you as an individual, for instance, I don't know if you're a civil servant or not, or a private individual, but are you on the healthcare insurance scheme? Are you covered? Are you enrolled?
So, healthcare insurance, most of them are bitterly complaining. At the beginning, the drugs are bringing to the people in subsidized rates, and everybody as a worker, you can afford, you can enjoy it. So in no time, so there is no drug for now. When you go to hospital, sometimes the type of behavior those people are given the drug are showing is unethical.
Right.
So sometimes they say there is no light, there is no computer is not working, and other things. So all this behavior, when you come, you are sick, or you come with your children, they are sick. You need to be rescued. You need to be attended in a manner that will be appreciated.
Right. But and I do understand where you're coming from with that. Yeah. Thank you so much, Malam Rabiu, for calling. We do appreciate this take. It paints a picture of the realities of most Nigerians, especially at the community level. That is the point that he was making, which is very critical, to say the least. More often than not, healthcare is always about dealing with very sensitive issues, life and death, as many would like to describe it. And he's saying the service delivery is less than satisfactory, and I think the jury is out on that one. Most Nigerians would say the same, and I know that there are some pockets of success stories here and there, but generally speaking, the healthcare sector is pretty much on life support, pun intended. So let's get more of your take on this one. We'd love to hear organic thoughts about what is happening at the community level, especially those who have coverage. What is your experience like? Rabi was just talking about how sometimes you can go there and before you access it, especially if you are on the scheme, there are always hiccups here and there about medication and things like that. I know for a fact that I've had to buy some of these medication outside of my coverage because the healthcare center that is supposed to provide me with those services are either out of stock or don't just have it, as a matter of fact. So these are some of the challenges that continue to highlight and inundate the system itself, and hence the reason why we have to talk about these challenges so that the government and the operators or regulators can address these needling challenges impacting the lives and the livelihood of Nigerians when it comes to healthcare delivery. So feel free to call in. We'd love to hear your take on this one. The numbers will be on your screen. You can also reach out to us on our Facebook platform, also on WhatsApp. You can do the same. Send us a message. Let's hear what you have to say about the healthcare insurance scheme in the country and what you think can be done to improve the service delivery as well as the implementation of the scheme generally. The National Healthcare Insurance Scheme is our talking point for today on Daybreak Interactive. I know most of you are eagerly waiting to see the numbers, especially first-time callers, but for those of you who already have the numbers, feel free to call in. We'd love to hear your take on this one. What do you make of the services? What do you make of the enrollment procedure or the processes? Are you enrolled as a matter of fact? Let's also talk about that. What are the challenges that you're facing in the enrollment process of the NHIS? These are the questions that would love to hear your answers to, and that is basically the conversation on Daybreak Interactive today on the program. The healthcare provider system that we have in the country has left much to be desired, but the government has recently also doubled down on the feedback mechanism where people need to give the government accurate information so that it can inform some of its reforms within the healthcare service itself or healthcare industry generally speaking, and also to give the government an idea as to what it needs to do better. Even though I feel like it's a no-brainer to talk about how some of these things are rather obvious, but many people have different views about this whole idea about the service delivery within the healthcare system, because if you juxtapose it with what is happening in the private healthcare sector, subsector of our healthcare ministry, you can see the parity there. And yeah, many Nigerians cannot afford private healthcare in this country. Let's speak to our next caller. Hello, good morning.
Good morning.
Welcome to the program. Your name, please, and where you're calling from.
My name is Shatima Yakudima, calling from Maiduguri.
Shatima, good morning. How is Maiduguri this morning?
Maiduguri is cool. It is dusty.
Yeah,
we are in Hamatan season.
Yes, I hear the Hamatan conditions are quite severe. How bad is it?
Well, Hamatan, the problem of Hamatan is only dusty, but you can have your way to prevent it. And I think, to me, it is better than the hot season.
Right, exactly. So let's talk about healthcare coverage. Let's talk about healthcare insurance. First of all, are you enrolled, and what do you make of the services?
Honestly speaking, I was not enrolled because the reason is very simple. Because if you are in health insurance, the hospital management, they are not so friendly to you. The services is very poor. And you see, most of the drugs are not available in the hospital. If you come as a health insurance beneficiary, they will see you as you come to take treatment free. Because it is very unfortunate the way they treat you it is different. It's not quite in order. And some of the drugs were not available. You can only get a cheaper drugs like paracetamol and the rest. Which one you are the one that you can even afford to buy? So I do not see the reason why I will enroll. Right. Because the treatment it is very, very bad.
Right.
And secondly, I want to call the attention of the management to please to make sure that when the enrollment come, they should do it speedy. You can ask many people and they will tell you before you enroll your children, it will take you 3 months. 3 months. Just imagine. 3 months. You see, if a child falls sick, you have to wait till 3 months reach before they start considering him, which is to me is very, very bad. They have to be the enrollment have to be very speedy. Yeah. Very speedy. They should enroll on time. And, right. And also the staff of the hospital, nurses and the doctors, they should know they have their own ethic of profession. But if you go to them, they will start treating you. The treatment is very, very bad. Honestly speaking,
I can understand.
They are treating people somehow. They lack manners, and the treatment that will give you is somehow. That's why I did not even enroll.
Right.
I did not even enroll.
Yeah. And just before you go, Shatima, I want you to paint a picture of what it costs to say, for instance, address a medical emergency or to access medical health care from your pocket on a regular basis, whether for you or for a family member. What is the cost like these days?
The cost, honestly, is very, very expensive, very, very high. And nowadays, even to treat a malaria, it will cost you much money. It will consume much money. So I don't know why. They capitalize on the condition that you find yourself. If you are ill, no matter what they tell you, you will not have. You don't have a choice. You just have to pay. So that's why they are taking that advantage of just a sick person. What he required, it is only his health. No matter how much you tell him, he will just pay you. So they are taking that advantage to just exploit people. Yeah. You see, that's the problem that we are having in this country. Health personnel, they have to be pure God. They should pure God. It's not the money that matters, but make sure that you have restored or you have give an ill person his health back. Right. Your road, it will be, with Almighty Allah. Don't look at the money that you will get.
Yeah. Shatima, as always, appreciate your invaluable contribution. I do hope you have a lovely day ahead. Thank you so much for calling in, as always.
Thank you so much.
Right. Shatima there from Meduguri, painting a very broad picture, which I think is much appreciated. And I think there are a lot of people listening to his thoughts and just nodding along in agreement to some of the points that he's raising there, because these are some of the facts that we are dealing with. Let's speak to our next caller. Hello, good morning, and welcome to the program. What's your name and where are you calling from? Hello, good morning.
Good morning.
Welcome to Daybreak Interactive. Who is on the line and where are you calling from?
From Jalingo. Hello?
Hello, good morning. Can you hear me? Right, I suppose we try the next caller then, because it looks like we're struggling with this particular connection. Call in. Let's hear your thoughts on this all-important talking point. Hello, good morning, and welcome to Daybreak Interactive. Who is on the line and where are you calling from?
Hello.
Hello, good morning.
Good morning, sir.
Welcome to the program. Who is on the line and where are you calling from?
This is Abasekong calling from Gombe State.
Please come again.
Abasekong calling from Gombe State.
Good morning to you and thank you so much for joining the conversation. Abasekong, how is Gombe this morning?
Gombe is cool, relatively cool, and the sun has just risen. We are just under the sun now.
A brand new day, isn't it? Go ahead, please.
Okay, thank you. Sincerely speaking, NHIS is a scam. They are just here to scam Nigerians. I enrolled when I was in Port Harcourt 2021. Up till to date, do you know that nothing, even my phone has not been text, nothing. I gave them all my numbers. It's just a complete scam. I stand to testify because I enrolled. I've not benefited anything from them. I've not benefited. Just that is the situation in Nigeria. That is the situation.
So tell me about your situation. Was there a point in time where it worked for you, or was it all just bad news throughout your experience?
No, what I'm saying is that I said 2021 I enrolled. We were asked to go to their offices and I went there, gave them all the forms, gave them my passport. Up to today I've not been called. I've not been called. No text message, nothing.
So you have not been onboarded and you don't have any sort of credential to show that you are on the system?
Nothing at all.
Since 2021.
I went there. That's what I'm telling you.
Right.
We were asked to go there. I went. At Port Harcourt. I went there. I'm in Gombe. Nothing up till date. No text. Nothing.
Right. Well, that is quite bad. And what is it like, for instance?
It's a scam. They are just out to scam people.
I
suppose I've not benefited anything from them.
I suppose your intention then was to get the coverage and it will cover your healthcare needs and wants, right? So tell me, now that you have to pay out of your pocket every time there's a medical need, what is it like to pay for medical bills these days?
Yes, sincerely speaking, since that time till date, I've not even gone to hospital, not even taken any malaria medicine or any. It has been God that has been faithful to me.
Right.
God has been so kind. I've not spent money. I've not visited the hospital. It has just been God. It has just been God, my brother. It's God. It's God.
Right. Thank you so much, Abasekong, for joining the conversation, and thank you so much for that perspective of yours. We really do appreciate you for calling in. Right. Apologies for that. Yeah. And I mean, these are some of the experiences that we want to understand. 3 years now since his attempt to enroll on the scheme or into the scheme, and he's been unsuccessful, and no word. Mum is the word. And I must say, just to contextualize his expression, NHIS is a scam. In the Nigerian parlance, what people mean by that usually when they say something is a scam is that, it just doesn't work. But of course, that is his own perspective, his own opinions about the NHIS. I suppose there are other people that have a different experience altogether. Hello, good morning, and welcome to Daybreak Interactive. Who's on the line and where are you calling from?
Yes, I'm back again. Daniel from Jalingo.
Daniel?
Yes.
Okay, you might have to speak up a little bit, Daniel. Where are you calling from, please?
I'm calling from Jalingo.
Oh, you're calling from Jalingo in Taraba. Okay, go ahead, please.
Yes.
Go ahead.
Yes, the discussion today is on National Health Care Insurance Service Scheme. Yes, it's a very good program, but honestly, I want to talk this on the experience in the rural area. Those schemes are not there completely in the rural area. That is the truth of the matter. Even those people in the town, in the urban centers, it's only few that have access to it. As a medical sociology practitioner, there is need for government to go directly to the rural people because that is where majority of the populations are. And another key point I want to raise on that aspect is not all illnesses that are covered on the National Health Insurance Policy. Most of these illnesses are small diseases that are covered in the scheme. Problems like kidney problems, liver problems, in somebody, the terminal cases are not mostly covered. That is the truth of the matter. And those are the cases the rural areas are mostly finding. No one can cure malaria in the rural settlement. But disease that has to do with surgical issues, that has to do with terminal issues, are not mostly handled properly in rural society. That is where the government needs to step in. In fact, for that program, the health insurance scheme to properly take off or to properly take place, the autonomy of the local government is paramount. Because the local government are closer to the people, they can handle this matter through their primary health care services properly. That is the truth of the matter.
Right.
So, just putting it in the urban center, which only few people, and in fact, education needs to take place. People need to be educated mostly on this aspect. So that is my take this morning.
Yeah.
The government should do more in the rural areas, and the local government autonomy, in fact, should be something that we are not supposed to play over it, because the local government chairman, they know the corners of all the local governments where all these illness, diseases are mostly found. For example, in my local government, there is a local government in Gashaka, in Taraba called Gashaka. The river blindness is paramount in that place. So the chairman of that local government and the people of that local government know some of these locations of where those things are. And they can now, with the autonomy of the local government, the chairman can have the power to build a health care center, maybe primarily for river blindness. This can also attract other people from other states to come there for their treatment.
Yeah.
Just like what is happening in Gombe State when it comes to snake bites. So please, they should try and do more. Especially, they should even involve the terminal cases in the scheme too. They should not just leave this to all this malaria, typhoid, and the rest. That is my contribution.
Thank you so much, Daniel, for that opinion of yours. I think it's well informed. I think it's well articulated. We appreciate you for joining the conversation, and his points stand true, especially about the local government autonomy, because part of their coverage area is to deal with some of these basic issues. Environmental issues, where we're talking about sanitation, waste disposal and management and things like that. And then I think specifically in the Constitution, they do take care of maternity-related healthcare services, where some of these services over the years are supposed to be offered free of charge so that we can guarantee the safe delivery of the next generation and so on and so forth. And he did also talk about how these coverage areas is quite narrow, where the rural communities are quite excluded, to say the least. Hello, good morning.
Hello.
Hello, good morning. Hello, good morning.
Hello, good morning.
Good morning, can you hear me?
I can hear you very well.
Welcome to the program. Who is on the line and where are you calling from?
This is James calling from Kaduna State.
James from Kaduna State. How is the Hamatan in Kaduna this time of the year?
So, Hamatan is really blowing in Kaduna State.
Right. I hope you're taking the necessary precautionary measures. Go ahead, please, James.
By the grace of God.
Go ahead, please, James. What's your take?
Yes, concerning this health insurance, is it compulsory for one to be enrolled as a civil servant into this health insurance, or is optional?
I mean, I think the idea, James, is that everybody is going to need this service eventually, one way or the other, we all fall sick, don't we? And this is an easy, cheaper way of accessing quality healthcare.
So, you see, the problem is that it is not actually yielding its purpose. Because if it is meant to help the civil servants, in this case, it is not helping. I remember in Kaduna State, Erufai made this thing compulsory. Then, if it is compulsory, there were those that were recruited for over 2 years, they were not captured. And for those 2 years, they were deducting it for them. Hello?
Hello, James. Are you still there?
Yes, I'm still there. I thought
Go ahead. Go ahead. Go ahead. Go ahead.
So, I mean, 2 years, there were those that were deducting their monies for 2 years without being captured. So they didn't benefit for those 2 years that their monies were deducted. So you see, that is one problem. Second problem now is that you are a beneficiary. You go to most hospitals, they will tell you that so test, test, or so kind of treatment is not captured. So you cannot benefit from so and so. So, but if you have your own money, you can benefit from so and so. So, and there are those that don't even want to be part of the health insurance, but government made it compulsory for people. I think it should be optional. That's my take. It should be optional for those who want to do, to go ahead to do. Those who don't want to do should be left, without involving themselves into it, because it is not actually yielding the purpose. And I want to encourage government, especially in Kaduna State, since we have a very another governor. He should also help in trying to monitor the process, because this process in Kaduna State is not actually helping civil servants. The governor should help in making sure that there are monitoring teams that will be monitoring the effectiveness of the program. I think it will help.
Okay, thank you so much, James. I appreciate your thoughts on this one. And thank you so much for calling. And I must say that we've had some very thought-provoking ideas or feedback from our callers this morning about their dissatisfaction with the system, with the idea behind it, and also some of those gaps that leaves much to be desired. And I think that it's a no-brainer. These are the realities of most Nigerians that have been echoed and re-echoed by some of our callers this morning. And that is all the time we have for Daybreak Interactive. But thank you most kindly to all our callers who have called in to give their contributions on this important conversation on healthcare insurance, the gaps that exist, and what government and other stakeholders within the healthcare sector need to do to address it. We're going to take a quick break now. When we come back, there's also yet another conversation that will be coming your way on Daybreak this morning. We're going to talk about food security and this idea that there is this disruption that is going on within the agriculture value chain industry itself. How disruptive is this, and why is the pushback becoming louder and louder by the day? More on genetically modified organisms and what it will do in terms of impact for Nigeria's food security after the break. Join us again.